It can be challenging for dentists to recognize when the lines become blurred between appropriate patient-dentist boundaries. The college recognizes that dentists may struggle with knowing when their friendly, caring behavior may go beyond what is appropriate to establish a professional relationship with patients. As healthcare professionals, dentists are responsible for establishing and maintaining appropriate professional boundaries with patients. Certainly, as part of a successful dentist-patient relationship, dentists need to establish a positive rapport with patients. However, it is important for dentists to be aware that what may be acceptable to do with friends may be inappropriate with patients. Here are some common scenarios that may occur in dental offices and some helpful practice advice for these situations. The dental office may be a stressful environment for both patients and dentists alike, and joking with patients may help relieve some of that stress. While sharing a joke with a patient may be okay, you should remember that the type of humor you use with friends may not be appropriate in a dental office. In addition, forwarding a joke to a patient via email or by text may open up further personal communication which is outside the dentist-patient relationship. Social media is another communication channel. In many cases, long-time patients of a practice become like family. However, it is the dentist's obligation to maintain a professional relationship with the patient and not embark on a relationship through social media, which may involve self-disclosure of the dentist's personal information through a personal Facebook account. Inviting a patient out for coffee or even offering them a ride home may seem like a kind gesture, but can be perceived in a variety of ways. It is important to remember that it is the perception of the patient and not the intention of the dentist that is relevant in determining whether a boundary has been crossed. As set out in the college's newly updated practice advisory on the prevention of sexual abuse and boundary violations, dentists should be mindful that patients bring with them a variety of cultural backgrounds and personal experiences which affect how they perceive your actions. Patients are inherently vulnerable. They are in varying degrees of pain or discomfort, or may be anxious about coming to your office. It is part of your job to make them feel at ease. You should remember to use words and not touch when trying to relieve a patient's anxiety or comfort a distressed patient so that you don't cross the line between a professional and personal relationship. Learn more about establishing and maintaining appropriate boundaries with your patients by visiting our website at rcdso.org. You can also contact our Practice Advisory Service for advice.